Hi everybody, and thank you for returning to listen to the lecture for Module 4, Chapter 11, Chapter 12, and Chapter 16. Here are objectives that we will focus on while we review the chapters. Here are some terms that I would love for you to learn: anorexia and dysphagia. Please know the difference and please be familiar with these. Now let's talk about nutrition. Nutrition has profound impact on health and functional capacity. Aging changes can affect nutrition. Now we know that sometimes the appetite, things that are going along with the body, it all can affect nutrition. The older adult may have poor appetite, may not just be feeling well. Health problems can contribute to it, various things. So this is why it's important that we do a nursing assessment and act on our interventions. Now, as you look at this slide, nutritional needs of older adults, look at all of the bullet points that I have. You know, we require amount of specific nutrients vary over lifetime. Well, older adults have reduced need for calories, less lean body mass. Also, the basal metabolic rate declines, as well as activity level. Now, when we look at quantity and quality of caloric intake, it must be monitored. The quantity and quality, making sure they're eating enough and they're eating the correct amount of nutrients that they need. Dietary fat intake, remember, is less than 30% of calories. Make sure of soluble fibers, It lowers serum cholesterol and improves glucose tolerance. Don't forget about that. When we're looking at our carbohydrates, remember we want to have a reduction of those intakes of the carbohydrates. But look at your protein. Protein is 10% to 20% of calories. And as we look at calcium, its absorption ability decreases with age. So don't forget about calcium. We need calcium and vitamin D for our bone health, but don't forget about in the older adult, for calcium, the absorption ability decreases. Look at your fruits and vegetables. Make sure that at least 5 servings are served daily. And then the modified pyramid for people over age 70. That's also in your book, and you can look at the modified pyramid. Now, when we look at nutritional supplements, remember, compensate for inadequate intake of nutrients and deficiencies resulting from disease and medication effects. So remember, we need to make sure if these patients have certain disease or things that are interfering with nutritional supplements, we might have to give them certain supplements. Nursing assessment. Make sure we have the type and amount of nutritional supplements. We may have to have a dietitian come in to do evaluation on the patient. Don't forget about the special needs of women. We also need these special needs. Sometimes the nutrition is related to risk for women like heart disease and cancer and osteoporosis. When we look at hydration, don't forget about that 1,500 ml minimum required for fluid intake. Once we make sure that, we need to make sure that we evaluate factors that may cause older adults to consume less fluid, like some are on fluids, risk fluid restrictions, and then also we have to monitor for overhydration. So look at our nursing interventions for good nutrition and hydration. So services to enhance nutritional status. Want to make sure supplemental nutrition assistance programs like food stamps. Our older adults might need that. They might need Meals on Wheels, shopping and meal preparation assistance. They might need home health aides for feeding assistance, congregate eating programs. What about nutritional and psychological counseling? They might need that also. And don't forget about the ethnic and religion factors. So when we're assessing nutritional status and hydration in older adults, make sure we look at the physical, mental, and socioeconomic factors that affect nutritional status later in life. Make sure we Look at regular nutritional assessment, looking at how much they eat. Remember our intake and our output. And also look at social aspects. Maybe the client likes to eat alone, or maybe some like to eat around a lot of people. So we need to really assess that. And then also consider cultural variables. You know, once again, I know I said it before, but we want to reinforce on ethnic and religious factors. Now, here's a quick question for you. Have you thought of the answer yet? If you said D, you're correct. Age, height, weight, and gender. Please read the rationale. Nutritional supplements compensate for inadequate, hold on, let me pause. Let's focus a little on promotion of oral health. You know, it's the ability to meet nutritional needs influenced by dental care throughout lifetime. So make sure that your older adults get proper oral health from the dentist. Periodontal disease causes tooth loss, and most older adults show pride in having all of their teeth. Nurses should educate about the signs of periodontal disease. If you don't know those signs and symptoms, we can always look those up. Mainly the bleeding when they brush in their teeth, having lots of bleeding or swelling. Older adults are now preserving their teeth, so you'll see more older adults with their teeth in instead of dentures. So make sure that they have effective toothbrushing. Remember, up and down at a slant, the toothbrush should go underneath the gums, okay? So we don't really use the swabs anymore, but make sure the toothbrush is at an angle when they're brushing up and down so you can get under the gums and between the teeth, okay? Same thing applies with the dentures. Make sure the dentures are cleaned well and rinsed well and have proper fitting. So also, when we look at threats to good nutrition, what about indigestion of food intolerances? Okay, those things, they decrease the stomach motility. Sometimes patients have less gastric secretions, and it lowers the emptying of the stomach. So our nursing interventions would be to monitor for these things. Make sure you do a good GI assessment. Listening for bowel sounds. Making sure the patient is not having regurgitation. Making sure the patient is sitting up at least 30 minutes after meals. Look at anorexia. Now, the definition I put earlier in the beginning of the PowerPoint, make sure you know anorexia, know that it's related to various conditions. Don't single out one condition, and we all need to identify what's causing this individual to be anorexic. Now, as we look at hydration needs for the older adult, I spoke on the 1,500 ml minimum required fluid earlier, but look at this. Intracellular fluid loss results in decreased total body fluid. What type of loss do we have? Intracellular. Remember, evaluate factors that may cause older adults to consume less fluid. We talked a little bit about this, but let's reinforce. They may just feel like they just don't like water, or they just don't feel like drinking that day, or maybe they're tired, they didn't sleep all night, and then they're sleeping all day. The medication is making their mouth dry, but they don't want to drink fluid, but their mouth feels dry. Different factors affects that. Look at the risk of fluid restriction. So we have to monitor that, looking at their lab values, looking at their BUN and creatinine. Look at the effects of overhydration also. That can also interfere with their body and what's going on with them today. Also, when we continue to talk about promotion of oral health, we need to make sure that we have the ability to meet their nutritional needs, just in case the dentures aren't fitting well, they have a missing teeth, problems with their gum. Maybe, like we said again, periodontal disease causes tooth loss. Make sure that we educate. We do all of these things. So good nutrition. Okay, indigestion of food intolerance. Decrease, I believe I'm repeating myself. Well, that's okay. So we'll make sure that we look at dysphagia. Remember, gastroesophageal reflux disease, which is better known as GERD. We have to make sure we look at that. If they have difficulty in swallowing, they may also have GERD. They may also, that dysphagia, it increases with age. There's different types. Let's look at the cause. What's causing this difficulty in swallowing? And then make sure we keep the patient's head of bed elevated also after eating. What about constipation? It is a common problem in older adults. So make sure we understand that the peristalsis is slowed down. Older adults have inactivity. That's why we want to increase their activity. Sometimes their medications have side effects that causes constipation. And also they have decreased fiber and fluids in their food, in their meals. So we need to make sure we increase that. And we just need to focus on preventive measures for this population. Now, when we're looking at malnutrition, look at some of the contributing factors that cause this. We always, no matter what the condition is, we want to know what the contributing factor is. We want to make sure we know the signs and symptoms of malnutrition, look at their albumin level, look at their body mass index, look at them as a whole. Okay, other problems that may indicate malnutrition, make sure we look at those. Don't leave anything out. What is the underlying cause? And when I say look at, I mean assessing. So let's assess nutritional status and hydration in older adults. We want to look at their physical, mental, and socioeconomic factors that could affect nutritional status later in life. We also want to look at the regular nutritional assessment essentials. Social aspects is important, and consider cultural variables. Okay, we spoke about this earlier, and I do know that I'm stating it again. So here are some nursing interventions. Let's move on. As we move on, I would like for you to focus on services to enhance nutritional status. Remember all of these, and we spoke of them earlier. Each one of these. As promised, I told you I would lecture for no more than 15 minutes. We're going on 12 minutes. And I also would like to focus on letting you know that this slide is left blank. And please stay tuned for the next lecture as I will speak on Chapter 12, Sleep and Rest. Thank you. Take a break from my voice, and I'll see you back for Chapter 12.